So let us revise what are the questions asked on mechanical ventilation. So what is mechanical ventilation? Mechanical ventilation is the breath delivered by machine. So it's a respiratory therapy which is given to support the oxygenation and ventilation of the patient when due to primary disease condition these things are affected. So while we treat the primary disease, the support of ventilation and oxygenation is done with the help of mechanical ventilation. So it's a temporary respiratory therapy. So I told you what is mechanical ventilation. It is breath delivered by machine. Delivered by machine. That is the ventilator. So it's a respiratory therapy. Respiratory therapy to support the oxygenation and ventilation. To support, control oxygenation and ventilation got it. So this is what is mechanical ventilation. Got my point? Okay, so how this breath would be aerialized or delivered to the patient? It depends upon the mode of mechanical ventilation. So to understand the mode and how do we select the mode, we need to understand what define a mechanical breath. So a mechanical breath is defined by how would it get triggered. So how the mechanical breath is triggered. So mechanical breath can be triggered by machine, that is the time triggered, machine triggered breath, or it would be triggered by patient, that is patient triggered. Okay. So if it's machine triggered, it is a controlled breath. If it is a patient triggered, it would be spontaneous or assisted breath. Then how it is cycled from inspiration to expiration. So it could be time cycled or it could be flow cycled, right? Mostly it is time cycle in most of the mode except PSV, in which pressure support ventilation, in which it is flow cycled. Then how the breath is controlled, that is the volume control or the pressure control. So two-way the breath will be controlled, volume or pressure, right? And what is the baseline pressure on which the patient breathe? And that in case of mechanical ventilation we use is PEEP. The baseline pressure on which we breathe is your functional residual capacity. Now functional residual capacity is the volume which remains in the alveoli after expiration, and we give PEEP in patient on mechanical ventilation, positive end expiratory pressure, and that is the end pressure on which inspiration and expiration happens. So I'll talk about PEEP as well. So these are the four factors which would define a breath. So let us talk about volume control and pressure control. What do I mean by volume control and pressure control?